Welcome to week 14 of our course. We have one more week after this. Today, we will be talking about physical disabilities, health disabilities, and related low incidence disabilities. So here's just a quick overview of some of the physical disabilities and health disabilities. Again, this is, I know I've talked about this before, but it's right in your book, so you can take a look at it there. Some disabilities fall under the category of orthopedic impairments, and this would include a neuromotor impairment, which is an abnormality or damage of or to the brain, spinal cord, or nerves that sends impulses to the muscles within someone's body. And that would include cerebral palsy or spina bifida. There's degenerative diseases, which affect the motor movements and make up the second group of disabilities within the category of orthopedic impairment. And that would be like muscular dystrophy. And then some of the musculoskeletal conditions that can result in severe limitations. And these are not also combined with having a cognitive learning, perceptual language, or sensory issues in most of the ones that can be found in neuromotor impairments. And that would include juvenile arthritis or limb deficiencies. And as you know, over the course of years and research, some of these are not as impactful as they used to be. I had an aunt who had juvenile arthritis and was in a home by the time she was like 17 or 18. And I do not think that would necessarily be the case today because of the preventative care that's out there. But these are some very serious disabilities. Other major health impairments. So these fall under other health impairment as well as traumatic brain injuries, which you can read about in the book. Some of the major health impairments can be treated effectively and others do not have a cure. Sometimes they can arise to emergency situations, or someone might have a nurse as part of their plan within school, and some can result in death. And one of the major ones that the book talks about are seizures. And if it's a severe seizure disorder, oftentimes they may have a nurse, or there's definitely a care plan that goes along with that student when they're at school. So a reminder for your assignments this week, you have an attendance quiz. You'll have a reflection paper that's due. It's your third one. You'll be answering the questions: what are the most effective ways to accommodate a student with a physical disability in the school setting? And how might these accommodations look specifically for a phys ed class? You have some discussion questions, and make sure you include any references that you have, as well as make sure you respond to at least one peer. And your research paper, your video, which is a summary of your research paper, and self-reflection are due at the end of next week, which is the end of our course. So as always, please reach out if you have any questions, and I hope you all have a great week.